Good late morning. I'm going to be very fast. We have a lot to do in a short amount of time on a very important panel, as have been all the others. I've modified what I'm going to say to you as we've been going along because of things that have occurred over the last day and this morning, plus a lot of the sidebar conversations during breaks and at lunch. I'm one of 5 brothers. I grew up in law enforcement before I became a university professor. I was a police officer. Another one of my brothers is a police officer. Another one's in juvenile justice. And another one of my brothers is the head of, soon to retire, head of child and family services for the Archdiocese of Baltimore and Catholic Charities. So we get into big debates in my family over this issue. Thursday night, my brother, the homicide detective, arrested a man who has mental illness for killing his wife. We had dinner Friday night. I told my brother about what we're doing here. I asked him some questions, and he made the point that I'm going to emphasize very quickly that the mental illness was irrelevant. He was dealing with a homicide. His exact words were, "It may come about later that people talk about it. That's not what I deal with. I had a man who killed his wife. I locked him up for murder." End of the conversation. Now, my other brother from Child and Family Services would have gotten into a big debate with him, but it's true. There are lots of areas. I want to keep focusing on opportunities for intervention. We've made great strides in the law enforcement community, and forgive me, I'm a lifelong cop. I don't get discouraged when you use the word cop. I don't get discouraged when you talk about donuts. We have important work to do, so I'm not hung up on terminology. There are lots of places where we can intervene and advance our work in criminal justice. I prefer the term justice, public safety, and particularly police work. And some of them are listed here. I'm not going to read all the slides. But it's more than just policy. It's more than just research. And there's a lot of low-hanging fruit, things we can change very quickly to improve particularly the role of police that doesn't cost a lot of money, doesn't take a lot of legislative change, things we can do. I'll show you one in just a moment. While we made great strides, it's important for our dialogue and where we go with this to understand that we've fallen backward in a number of areas. We were talking about crisis intervention teams. Outstanding. But because of declines in federal funding and crises in local budgets, they've gone away a lot faster than they were developed in many of the jurisdictions, particularly the smaller and medium-sized jurisdictions in this country. Here's low-hanging fruit. The official radio code used in public safety by APCO, the Association of Public Communications Officers, puts out a 1096 call to police. 1096, since I entered the field as a patrol officer in 1969, has been mental subject, not person with mental illness or person who has mental illness. It's a mindset. And we can change it if we come together just to lobby APCO to make a change in the 10 code, which is used by about 90% of the public safety agencies in this country, including fire EMS. Something that simple, but not unimportant. Some brief points of focus. Frontline police patrol officers, and I'm going to be talking about the front line a lot as opposed to policy and law and executive role, believe pretty much across the board that people in the mental health community do not understand what they do. Low-hanging fruit, something we can come together to change. It's important that you understand that 70% of a law enforcement officer's, police officers, deputies, troopers' job in this country has nothing to do with law enforcement. We just keep being referred to as law enforcement. 70% of what we do is service-related. The smaller the community, townships, the higher that percentage. Much of what, this is very important to get across, much of what police officers do in this country, and specifically for our conversation, in service to people with mental illness, never makes its way to a report and is never reflected in the data. A lot of great stuff goes on, and some mistakes are made that we don't know about. And I would contend that we know less about what goes on than we actually do. And it happens on a pretty grand scale. And even some very, as amazing as it sounds, some very severe situations in which police officers intervene in this country don't make its way, those situations don't make their way to data because cops don't like to do reports. So they'd rather just take care of it, make people as happy as they can, get somebody into referral, and then go back about their business. The last item is the most important thing I want to get, one of the most important things I want to get across to you. We know over and over again that police officers in this country want to do more to serve the population, special populations across the board, people with disabilities, than time and resources allow them to do. So they're not the cold, impersonal, just the facts man people that many think. Now, we're talking about what some people have termed the most fragmented profession in the United States, the American justice system, just to give you some perspective. And we include, in the division I'm in at Hopkins, we include the mental health community in the broader definition of public safety, which is something most people don't do. But there are about 18,000 state and local law enforcement agencies in the United States. We really don't know how many there are because, amazingly, if they have 10 or fewer officers in the department, they are not required to report within the federal reporting system. Some states require small departments to report, some don't. It's even more fragmented if you look at it globally. By the way, there are only 67 large police departments in the United States out of the 18,000, and they make up a group called the Major Cities Chiefs Association, along with 7 large departments out of Canada. But out of that 18,000, fewer than 1,000 represent large jurisdictions. Across the world, police agencies can range from branches of the military to one national police department to 3 or 4 in an entire nation. We estimate that there are about 3,365 jails. We don't know for sure, and nobody knows how many courts there are. We know about how many trial judges there are, but we have no idea how many courts there are because they set them up and they go away for different things. If someone said to me out in the hall how many mental health courts there are, I can't even tell you how many criminal courts there are. We don't know. We can guess, but the data is very weak on that. Very important point, today's police officers, today's police chiefs, many were not born when we had the conversation about deinstitutionalization and community-based services. It doesn't ring at all with them. Policing in this country is primarily a reactive profession still. Most calls for service involving people with mental illness are for minor offenses. Never make their way into the kind of dialogue we've been having here. They're dealt with and everything's fine. It's very important, and we've had 2 conversations out in the hall since yesterday morning about this, where police officers intervene in a crisis and some degree of force is used. In most situations in which force is applied, non-lethal or lethal, lethal is deadly force, shooting, the officer generally has, and this has been borne out by the research at the Federal Law Enforcement Training Center in Georgia, the police officer has about 2.5 seconds to make the decision to apply that force. The Monday morning quarterbacking, the reassessing of the situation will occur for months and even years as we go through the justice system. But the actual decision in a confrontation, and I've had I don't know what you'd call it, I've been involved in 3 shootings. There's not a lot of thinking that goes into it. At the point of the use of force, you have to consider who's in the line of fire, you have to scan the environment, you have to decide whether or not it falls within the realm of policy and law, and then you have to take cover and do the deed. About 2.5 seconds. In regard to mental health, some of the conversations, some of the other panels, most people don't realize that in this country, the majority of police officers, deputies, and troopers do not have interjurisdictional authority, even within their own state. So they can't even cross the county to get someone into some placement without special approval by the department in that county, which works well if it's not 3 a.m. on a Sunday. I already mentioned crisis intervention teams are outstanding and still exist in many of the cities. They're outstanding, but they're going away at an unbelievable rate. Police training, a study was done of the post, the certifying bodies in policing, police officer standards and training groups. Let me be real simplistic. The amount of training a police officer gets in this country in regard to mental health is on average about 2.5 hours. Most of that is process focused, what to do when you're involved in the situation. Very little is focused on purpose and ideology and importance. Here's what you need to do. In a study of 28 police academies from around the country where we tore into the curriculum, the average training is about 2.5 hours. To put that in context, the average police officer's total training, very important for people in the community to understand, ranges from about a low of 16 weeks to a high of about 24 weeks, and then anywhere from 8 to 12 weeks of field training, apprenticeship with a senior officer. And you're talking about a 21-year-old kid for the most part. So when we say, why don't the police, you're talking about young kids coming out of the academy with as little as 16 weeks of training, and then we expect them to intervene as if they've had a wealth of education and lots of tutorship. I'm going to be very, very quick. Just to put the courts in some perspective, the bottom line is the ratio of trial judges in this country has actually declined over the last 30 years. When you look at the judges to population, judges to workload. And this data is here for you. I'm not going to spend a lot of time on it. But we say, why don't the courts? Read the quote from Judge McCrone. Time is what I don't have to give. I know there are important needs that trial judges do not adequately address. I don't see a solution in sight. And judges across the country say the same thing, echo that comment. What's really interesting, we keep talking, and we talked yesterday, you're going to hear more about it in just a little bit, about prisons and jails and lockups. They're very distinct. You can see they're run by different entities, police departments, sheriff's departments, departments of corrections. There are state penitentiaries, state prison systems. They're the most sophisticated. Then you have county jails. Generally, very simplistic because it varies by jurisdiction. If a person is going to serve less than a year, in some jurisdictions less than 6 months, they'll go to a local jail. If they have a longer sentence or it's for a more serious crime, they'll go to a state system. And if they violate federal law, they go to federal system. But there's no consistency. People who have mental illness who have been incarcerated, we estimate about 1.2 million. But what's very important is we cannot distinguish in that number, unless some of you have the research, the number who are awaiting trial versus the number who have been sentenced. And that's a very important piece of information because it's misleading that 1.2 million are in jail serving time. A large percentage of them are in jail awaiting to get their turn before a judge or a trial board or whomever is going to the hearing board to make a decision. Noting some of the obvious, I threw this in based on a conversation that occurred yesterday, and I'm about to wrap up, about the bias against people who have mental illness who are in the system. The system's biased. We have lots of biases, and That's unfortunate, and we will always work to try and get them, but it's not unique to people with mental illness. Things police want you to know. And if you get nothing else from what I'm sharing with you, we need to learn more across professions about our culture, about how we work, not just our policies and processes and laws. Most police in this country function alone. They're somewhat unique within our government system. Different from the military, different from fire EMS. A police officer on the beat functions alone. In many smaller jurisdictions, there's one police officer on duty for the entire town for an entire shift. So we say, well, why aren't you taking the person who has mental illness and getting them into care? Because you eliminate that officer and, in essence, police protection from that town for the 2, 3, 4, 5 hours it takes for that to occur in some jurisdictions. In my former department, you were not allowed to transport someone who has mental illness without 2 officers. On a busy shift, we didn't have 2 officers. Hence the criminalization of the system. I could get that person into a lockup a lot faster than I could into a mental health care facility. Again, these are up here for you to read. I'm not going to go over them. I emphasize again that one of the failures of the system is that when something occurs, we're out there 24/7 on the street. When something occurs at 3 in the morning on a Sunday, particularly if it's a small jurisdiction, the system fails. It collapses completely. Judges don't want you to wake them up. You can't get hold of prosecutors. You can't get hold of mental health workers. You're on your own, hence criminalization. Sometimes it is the only alternative available to us. Families don't understand it. Another thing I hope we end with, and that I'm going to emphasize later in the wrap-up, is that what would really help is if we did a much better job of educating people with mental illness, people who have mental illness and their families, about what they need to know when they interact with the police. Now, I'll just give you I'll close with a quick example. I have many more things to go over, but I don't have time. A few decades ago, we killed deaf people. We in law enforcement. We would make a stop, and the deaf person would reach, the person who has deafness would reach for a pad, a pen. We'd be going up to the car, particularly at dusk for some reason, saying, keep your hands on the steering wheel, keep your hands on the steering wheel. The closer we would get, the more the person would panic. We would shoot. They would come up with something. They would turn quickly. In 1 year, we killed 14 deaf people in the United States on traffic stops. So we started teaching police officers what they could do. It didn't stop. When we got hold of folks at the National Association for the Deaf, and we started teaching simultaneously people in the deaf community what they needed to know to do when stopped by the police, it changed. In the last several years, there's been no incident. But the learning had to occur on both sides. Finally, we need to focus on point of entry into the system. We've been talking much loftier: policy, procedure, law, executives, funding. We need to focus on point of entry into the system. What someone says when they reach the 911 call taker will set the tone for everything that happens thereafter. A lack of information, creating urgency about something that really isn't, will cause, create the foundation for everything else that occurs. The second point of entry is the police officer interacting with the family and the environment, or whatever the situation is. The better we focus on point of entry, the better we can control and manage the situation thereafter. Thank you.